All right. What a most common thing with all these bugs is it's going to be some diarrhea-related thing, okay? So we have got increase in ESR. That means there's some infection going on, or inflammation, sorry. All right, see that the differentials, what does it represent? It represents that what is the common thing? That this is some diarrhea going on, right? And then we have the increase in inflammation as well. All right, so there's a diarrhea and inflammation with all these bugs. Let's just see. How about else we got? Temperature is like normal. That means it should be above 100 if it's going to be the infectious. So we're going to rule out all the infused causes. Okay? Anyhow, so a woman comes to you with the interabdominal pain and the non-bloody diarrhea. First thing is good infectious diarrhea, but since there is no titer, so we're going to rule this out. It could be IB, it could be IBS, it could be lactose intolerance, it could be celiac disease, it could be fibromyalgia with its stuff. And okay, so it is like chronic, so there's like nothing acute. When it's chronic, so you have weight loss as well because of the tonicity. Okay, we had the cramp abdominal pain into the right lower quadrant. So this is the part where it's a pain. So you can pretty much make your deities over here. Veils, of course, because of the diarrhea, and she more like the diet. That is the most sane thing to do to relieve yourself, okay? Which represents it is either the CD of the lactose intolerance as of now. Okay, this is the complication of the surgery that she had ruined, and she takes just the OCPs, and there is she never covered. That means for the giardia, we need to have a Hacker's history, we need to have the travel history, we need to have the fouls having poisies too, we need to have vitamin D deficiencies because of the fat malabsorption. So nothing like that. Okay, but everything is normal. The left lower quadrant, we have the sorry, right lower, we have the pain. So, okay, and then we have got this. The moment we see the two things, the moment we see this, along with this, we know it is the IBD and we know it is a Crohn's disease. For example, in ulcerative colitis, it's going to be a bloody diarrhea. There's going to be a tennis mat. There's going to be like, changing the caliber of the stool B, and it is a non-bloody, so we're going to cut out. This is the Crohn's disease. What else have in a Crohn's disease? Starting from the eye, you have the uveitis, anything related to the eye. You have the mouth ulcers, from mouth to anus. You can have a disease presentation in any form. And it can have the scabisions, it can have the fistula, it can have the abscess, it can have like the thickening of the bowel. And there is going to be a lesion because of the thickened surface. And then you can have the erythema nodosum. You can have the bioadenine neoplasm, and you have to Google this out. It can possess derm symptoms, but it could be IB. How we see these and these. Then you go in. So yeah, this is the eye disease, and then we have like thickened bowel, and the lesion. Okay, so let's just see. We have the IDs, we have the mouth, starting from head to go, it could go to else. You can have the skip lesion, you have the erythema nodosum, we have the bioedema, granuloma, we have the abscess, we have the fistulas. We can give the glucocorticoids, we can give the 5-HT, we can give the aminosalicylic acid, we have the, NF-alpha inhibitors. Let me just screenshot it out. So I think